Wave if you're here. Hello. All right. We are now live. Okay. Hello and welcome everyone to today's video where we're going to be talking about therapy. And this is something that I feel like is a really, really important subject for us to talk about because we are living in a world right now where therapy is something that is gaining in popularity. And I think that this is a really, really good thing. I think this is a really, really positive thing. And where people are really starting to take their mental health seriously. And again, that is something that I think is obviously super valuable, super great. We need to be doing this. I'm glad that society is realizing that we have trauma and that we have issues that, can be really benefited, that we can really find actual solutions and we can find actual peace and we can find actual progress in our lives via being cared for and getting strategies for life and emotional regulation and emotional awareness and all of these things that have been missing, I think, in our culture for a very, very long time. So I want to be talking about this because number one, again, I think that this movement towards people understanding that therapy is important and that therapy can be helpful and that it's something we should invest in is an excellent move. At the same time, I want to be clear that I wanted to make this video also to address the shortcomings of therapy. I wanted to make this video to talk about where people may have been harmed in therapy, to give voice to the idea that therapy is not always the best thing in every circumstance. And I really wanted to speak to the idea that some of us have had therapy and it has not been helpful, and or some of us just don't have access to therapy because let's be honest, right? Therapy is very expensive. It is something that can often require being in certain places where therapy is available and time zones and internet connections, and it's not just something that everyone can access. And again, if we're getting into this place where we're hearing from people that like therapy is the only modality that's ever going to help you, and if you were not helped by therapy or if you don't have access to therapy, well, I guess you're just shit out of luck. I wanted to speak to that today too because therapy is not the only thing that exists. Therapy is not the one kind of gold star measure for all healing. And I think that if we can understand what therapy is for and where it is helpful and where it is not and all of these things, we can, again, have a much more nuanced and complex conversation about therapy. And we can avoid feeling really discouraged, like we're never going to be okay if therapy didn't work for us or if we don't have access to therapy, because that's not true. Okay? So today, again, I'm coming from a place of I am not a licensed therapist. I am not gone to university. I am speaking from someone who has been a coach and a life coach and worked with people and worked with people's emotions and worked with people's feelings and all of these things for the last 15 years of my life. And someone who has gotten therapy, both really good therapy and really, really terrible therapy. I have a lot of experience with my own experience in therapy, and then I've also known a lot of people who have gotten a lot of therapy and have taken in their positive and their negative experiences. And again, I'm also someone who's in the coaching industry and especially the spiritual coaching industry, who has watched for years as people have gone through different phases and modalities and offerings of this is going to heal you and this is going to change your life and this is going to be the thing that takes away all of your pain and we're going to get rid of your ego and you just need to do these fasts and blah 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 blah. And a lot of it just being either completely useless or harmful because it was missing the point of where people were actually coming from and what people actually needed. And this being something that has made people come to a place of kind of swinging the other way, of saying like, I'm not going to trust anyone who's not like a licensed therapist, because there is just so much garbage in the self-help, personal growth, spirituality world. And I really want to speak to that, and I want to validate that today. So that's the perspective I'm coming from. And I'm coming from the perspective of someone who has like a school to teach people how to have emotional awareness and how to go back through their history and learn how to support themselves in finding a better way of life and working with negative emotions and negative experiences and physical health problems and all of this stuff in my mystery school. As not a licensed therapist, I'm working from someone who's got a lot of, again, experience in my personal life, experience with working with other people, and studying therapeutic modalities outside of a university context, and really looking at what actually works for people and what doesn't, and understanding that, we can learn outside of a university setting, and also, again, to totally validate that if you are watching this and it's like, who is this girl? She doesn't have credentials, all of that stuff. Her opinion doesn't matter. I totally validate that. And that's legit for me. I think that any values that you have and any boundaries that you want to set with people that you're going to work with and that you are going to trust to be able to actually support you in moving forward in whatever way you need to move forward, have those boundaries. I hope that everyone would respect that. And if you only feel comfortable talking to a licensed therapist who has a PhD, do that. Honor that. If you are someone who has done that and that did not work for you and you're open to speaking to other people, do that. And again, I'm going to talk a little bit about how we can protect ourselves in a therapeutic environment, because it is not always safe and it is not always good. And just because someone is licensed doesn't mean that they're going to be capable. So that's what we're going to be talking about today. That's the perspective I'm coming from. I offer coaching and emotional mastery work and all this stuff as a non-licensed therapist, because I don't personally believe that these things can only be taught by licensed therapists. But that's just my opinion. You might have a different opinion, and that's okay. Okay, so let's first start with the idea that, again, in the coaching and the spirituality, self-help, personal growth world, it is very true that for a very long time, it has been like the wild, wild west, where anyone can kind of just posture themselves as an expert on anything. They can say, this was my life experience, or this is what I know to be true, and they can paint a picture in their social media of being healed or transformed or whatever, and they can then represent or kind of present a modality or a technique or a thing and say, this is going to be the thing that heals you. Just follow the thing that I did, do the thing that I did, and it'll solve all your problems and it'll wipe away all of your past history. And there was a long time too of people really speaking to people's trauma and people's pain that very much happened because of this lifetime, right? That very much was their childhood. It was growing up in the cultures we grew up in. It was traumas that we experienced. It was neurodivergence. It was all of these things that we can very easily point to and say, yeah, that is the thing that hurt you or that harmed you. And these people were saying, it's a past life thing, or it's your karma, or it's some spiritual block you need to heal. And so again, we had a lot of modalities and we had a lot of people practicing a lot of different tools and techniques that just either, like I say, at best were kind of nothing. You paid for nothing because it wasn't addressing the real issue. Or at worst, it was harmful. It really did just, delay proper therapy, and it delayed actually getting to the root issue, and it was a distraction and it had nothing to do with reality. So the fact that we're kind of coming from that, where people were just really trying hard to heal through whatever method they kind of could conjure up, And to understand that a lot of people who sold, kind of healing and coaching and you just need to pull yourself up by your bootstraps, or we just need to, do a dragon visualization and it'll clear all of your family history and all this stuff. That people were doing that and still are doing that from a place of, uh, I think, a lot of the time, innocence. Like, it's just they don't know what they don't know. They aren't connected to what they're not connected to, and they're just trying to feel better. And then I know that in a lot of ways it can look very predatory, and sometimes it is. I absolutely validate that. There are people out there who are preying on people's pain and what they've been through as a way of getting themselves clout and getting themselves authority and power over people so that they can take advantage of them. And they're selling healing modalities that are not healing modalities, that are designed to make you feel like something is happening in the beginning. And then when it doesn't heal you, they tell you it was your fault. It's because you didn't try hard enough. It's because you didn't do good enough. And then you feel like you need to keep buying for them and you need to keep getting their coaching or their spiritual advice or whatever it is, or you feel like you're failing because you're not getting better. And this is very predatory and this is very not okay. So the first thing that I want to say is, no matter what modality you're using, therapy, not therapy, spiritual healing, it doesn't matter. If you are not getting the results that you are being promised, that is a problem with the therapy. That is the problem with the modality. That is a problem with the teacher. That is not a problem with you. Okay? If you are showing up to the degree that you can show up and you're trying to do the thing and it's not giving you the results, and you are continually being told that you are not getting results because you're not trying hard enough, because you're not doing good enough, because you're resistant to healing, because there's something wrong and bad with you, that is a red flag. Okay? No matter what you are doing, if your person who is trying to support you is blaming you, even if it is true that you're not doing it, even if it's true that you're not using the modality to the best of your ability, there should still never be a you are not healing because of you, and that's wrong and bad because of you, and you just need more of this thing. There should always be a, okay, why can't you do it? What's going on with you? How can we adjust the tool or the process or the practice to meet you where you are at versus trying to force you to do it more? And if there's a constant, I'm doing it and I'm accomplishing it and it's not doing it, and there's a upsell and an upsell and an upsell, and you just need to go deeper and you need to go to the next mastermind, and that's another red flag. Okay? So again, in the coaching, spirituality, self-help, personal growth world, there is a lot of predatory, shitty stuff that people are doing and that people are teaching. And so if you, again, are in a situation where you are engaging with any of this stuff and you are being blamed for your lack of progress, that is a red flag. It is not right. Okay? There should always be either this modality isn't for you, or we're not doing it right to match where you are. It should never be that you are being blamed. Okay. So now that has led, I believe, to we all need therapy. We all need to go to a therapist. We all need to just talk to a real therapist. And this is what is going to help a lot of us move forward with our pain and our trauma and our neurodivergence and our not being able to get along in life. And to a degree, like I said, this is incredibly beneficial. Because here's the thing, right? Like, therapy is kind of like saying medicine. It's a huge umbrella term that covers a whole bunch of different things and a multitude of different modalities. And I think that when people say therapy, generally what they're thinking of is like traditional talk therapy, right? Where you sit down with someone, you tell them your problems, they listen, they maybe give some advice, and that's what's happening. Okay. So this kind of traditional talk therapy, where you are there to just be held and be supported and be validated in your experience and validated in your feelings, where you can process what's going on with you verbally in the presence of someone who has, some understanding of mental health and how our brains and our psychologies work. This is, generally speaking, a pretty helpful thing for most people who are going through kind of the regular traumas and dramas of life. And even deeper than that, like if we've got like some really unprocessed stuff from our childhoods and trauma that we've experienced, again, we want to be able to meet with someone who has awareness of the trauma we have experienced and who knows how to validate us and to give us tools to work through that trauma. But again, I think in a lot of ways, the thing that is benefiting most people when they go to therapy is to actually have a place to explore their thoughts, their feelings, and their emotions in a safe environment. And understanding that we are social beings by nature. And so having someone be in the room with us to validate our experience, to tell us that what we feel matters, to maybe ask some probing questions, this is for most of us going to be an incredibly valuable experience because we just don't have this in our culture. We are not used to self-reflection. We are not used to sitting and thinking about how we're feeling or how life is making us feel. We're not used to having someone just pay attention to us and validate our experience and not necessarily offer advice or give tips or tools or anything, but just have just someone compassionately witnessing us as we process our own stuff. I think to a degree, this would benefit pretty much everyone because, like I said, it's rare that we get this. And most of us haven't developed the capacity to do that on our own. And again, like that's a lot of what I teach in the mystery school is how to be that safe place for yourself and how to do this processing work for yourself. Because again, a therapist is just another human in the room with you. And sometimes we need that. And sometimes that is super, super important. And sometimes we're not going to have access to that. Sometimes we're not going to be feeling safe in that. Sometimes that's not going to be something that's, like I say, available to us. And that doesn't mean we can't have it, right? That we can develop these tools and these skills on our own. Okay. Second thing is to understand that your therapist, whoever you are working with, is not a mind reader, is not in your life, and is someone who can only help you with the things that you are aware of and that you are bringing to the table. Yeah? So again, not to say that you have to be like perfectly self-aware in order to like tell your therapist everything that they need to know so that they can help you, because none of us are. None of us are perfectly self-aware. And if you have a good therapist, they should be able to pick up on your languaging patterns and pick up on your the stories that you're telling, and they should be able to ask good leading questions to help them better understand where you're coming from, even if it's not clear to you where you're coming from, okay? So this is not to say, again, that you have to have perfect self-awareness for a therapist to be helpful. And hopefully a therapist is able to have insights about you and is able to understand you a little bit better than you understand yourself in some ways due to their training. And that can help you to understand yourself better. And that is good therapy, okay? But we also have to remember that all of us are coming to therapy with our perspective, with our filters, with our lack of awareness and lack of connection to ourselves and lack of all of these things. And a therapist is only able to work with, essentially, what you give them, right? So we have to understand that we can't expect a therapist to always be able to figure out what we need and to have good advice for us. Because sometimes what we are able to tell the therapist is happening with us isn't clear. Okay, so I have an example of a friend who was really traumatized in her childhood and really, really, really just, it was not good. And part of the way that she had coped with what she went through was learning how to dissociate from her body and her feelings and her emotions. She learned to be very much in her head and very intellectual, and she like literally didn't know that she didn't know that she wasn't connected to her body, that she wasn't connected to her feelings. She didn't know she was dissociated because that was her experience. Okay? So this kind of illustrates the point. So then she goes to therapy, and the therapist is doing talk therapy, and the therapist is all in her head, and the therapy wasn't helping. She was talking and talking and talking and processing and processing and processing, and it just felt like nothing was happening and nothing was going on because it's not what she needed, right? She was in a state where she was already up in her head all the time. She was already thinking about things all the time. And more intellectual, verbally processing things wasn't helpful for her. She needed someone to realize, oh, hey, you're like totally dissociated from your body. You're not in your emotions. The blocks you have in your life right now are very much coming from a lack of emotional connection to yourself. And a lot of your trauma and a lot of your experience is like stored in your body and stored in your emotions, and that's where we need to process in order for you to make, you know, changes to how you're seeing the world and how you're feeling in the world and all this stuff. But the therapist didn't know to even approach that because the person that I'm talking about didn't know that this was a thing that they even needed. And so, again, we need to be aware that a therapist can only do for us. Any coach, any person, any modality that you're going to go to is only ever going to be able to do for us what we are aware of in ourselves enough to bring to the table. Okay, but again, it is possible that that therapist could have realized, hey, this is all very intellectual and we're constantly talking about your thoughts, but how do you feel and what's going on in your feelings? And it would have been great if she had done that. But we have to understand that just because someone is licensed, just because someone has gone to school, just because someone is, you know, very credentialed, doesn't mean they're going to be able to pick up on where you're at and what you need. Because again, our mental health and what's going on for us internally is often incredibly difficult to communicate because it's just our experience. We often don't know that what we are experiencing isn't what everyone else is experiencing, isn't just normal. And to be able to even have that perspective, to have someone say like, whoa, okay, you're feeling these things a lot. That's not normal. Not everyone feels like that. That's not what's really happening. Is a really difficult barrier to get over. Because again, our perspective of our feelings and what we are going through is just, this is what's normal to me. This is what makes sense to me. So for us to get to a place where we even recognize we have a problem, and then we can recognize what that problem is, and then we can seek appropriate help, is challenging. So this is why the next thing that I want to say is that any therapist, any person that you work with should be starting the communication even before you have a session or they give you a free session with asking you a shit ton of questions. Okay? This is what I think is super, super important, that no matter who you are going to work with, therapy, not therapy, any modality, the person that you are about to work with should be very, 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 very interested in getting to know you as much as possible before you even start your sessions so that they can know if their modality is going to be helpful for you. Okay? It is up to your therapist and it is up to the person who's helping you to be very clear on what they actually have to offer, who it is that their offer actually supports, and to be doing a lot of investigatory work. If you are a millennial, you will know that is a line from Zoolander. They should be very, 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 very focused on making sure they are getting to know where you are actually at and what you are dealing with as much as they possibly can before they say, yeah, you should spend money on my service. Okay? So this is something I wanted to say for a while, but if you are in any space with a person who is a therapist, is a coach, is a person who offers help, and you see them on the internet giving unsolicited advice to people they do not know, you see them assuming that they understand what's going on with other people and saying, my modality or my thing, this is what you should do, this is the thing that would fix your life, you are this and you need this, please see that as a red flag. I'm going to say that again. Any therapist, any person who's credentialed in anything or not, who's out there saying, I'm a coach, you should work with me, who's on the internet or anywhere diagnosing people, saying, I think you have this, I think this is what's going on with you, this is clearly what this is, and this is what you should do about it. And they don't know the person, they didn't lead with questions, they didn't lead with getting to know the person. And if they do this to you, if anyone in like a intro session is more interested in telling you what you should do, in telling you what their therapy is, in telling you what's going to work for you before they've even asked you questions, walk away. Okay? Any therapist, any helper, anyone out there needs to be very, very, very invested in getting to know you before they offer any advice or tools. And like I said, they need to be very, very interested in making sure that their modality, that their scope of practice includes you. So if anyone is out there saying, this is for everyone, this work will work for every person, I am a therapist for every person, I am a healer for all purpose, that is a red flag. Okay? No one is able to do everything for everyone. Even just a generic therapist is going to have speciality. They're going to have, this is the thing that I'm pretty good at working with because I have my most experience with this. And if you fall outside of that, there should be a very clear, I am not the one for you. Okay? So whenever you're looking for a therapist, whenever you're looking for a coach, whenever you're looking for anyone to support you, really make sure that they are attuning themselves to you and not asking you to attune themselves to them. Okay? That is so important. Next thing. If you experience harm in therapy, do not distrust yourself. Okay? I have had many negative experiences in therapy to the point where it made me think that therapy was garbage and I was never going to get therapy ever again. And I needed it. But I had so many people, I had many, many therapists tell me, like literally in the early days of my teenage years when I was just like so overwhelmed, chronically ill, neurodivergent, sensitive beyond belief, being traumatized in my home, being traumatized at school, like every mental, emotional thing that could be happening to you was happening to me. Tell me I was just too good for this world. Or tell me life is just going to be hard for you. Or tell me that, you know, you are just this way and this is just how it's going to be. And that may have come across to them as like helpful advice. But for me, it was like deeply not helpful. And I have had many therapeutic experiences where the person that I was talking to was not able to hold the kind of gravity of what I was experiencing, and they allowed me to go into kind of like caretaker mode for them. Or, I sensed that they were uncomfortable or that it was over their head. And so then I pulled back and I wasn't honest and I just said the things that I knew would make them happy. And I also have had a lot of therapists who I was able to kind of sweet talk my way out of addressing the issues that I really needed to address, because I was really good at convincing them I was fine, because that was part of what I'm good at. And so I've had that experience. I've had therapists break down and cry when they heard my story and what I was going through, and just say like, this is the worst thing I've ever heard. This is like all these things. And again, it's like, I understand that they were trying to be supportive and they were trying to be on my side, but it just was really not what I needed, you know? And I've had therapists be really harsh with me. And again, the whole, you're just not trying hard enough, you're not doing it enough, this is whatever. Therapists getting triggered by me. And I've also witnessed this a lot in some of the people that I know, that like therapists just getting overwhelmed and being triggered and saying things offhand that if I or the person that I was talking to wasn't self-aware enough to be able to be like, whoa, okay, you got triggered and that wasn't really about me, the damage that could have done. So again, understanding that therapists are also human, and that not all of us have had safe and good experiences in therapy. And I really want to validate that right now. Okay? If you are someone out there who therapy has not worked for you, it didn't help you move forward in some way, it didn't help you feel better, it didn't improve your situation, or where it felt like it made things worse. And the second thing is, if you were not able to establish a secure connection with your therapist, right? If you were not in a place, or if they were not in a place to be able to be a safe space for you, and you have had in your history like a really hard time trusting people, and therapists have not been different, again, please understand that there's nothing wrong with you, that you are not broken, and that could be that the therapist just wasn't the right therapist for you. Not all therapy is going to be like that, and not all therapists are like that. And if you have the time and the energy and the resources to continue to look for someone to support you, instead of feeling like you're now just stuck in your pain and you can't do anything because you've tried your best to heal it and you can't do it on your own, but in the sense that you know that you need help but you haven't been able to find help, keep looking. Okay? Don't let one or two bad therapists convince you that therapy is horrible and that no one will ever help you, because this is not true. There are a lot of people out there with a lot of different backgrounds and a lot of different training, and again, sometimes just finding that person who has the speciality that we need them to have, who knows how to address what we are going through, just takes time. And I realize that is a luxury that we don't all have. Okay? So if you do have that luxury, if you are in a situation where you can do that, I would highly suggest you keep looking. Don't give up. If you know you need support, don't give up until you find the right person, and don't settle for someone who isn't the right person. Do not settle for someone who cannot show up for you, who you don't feel actually understands your situation, who gaslights you, who makes you feel worse about your life than they do makes you feel better about it, don't stay with that. Okay? Leave that situation. Go find someone who is helpful. Okay? Because there are a lot, like I said, there are a lot of different people out there with lots of different capacities, and just like one or two bad eggs are not everyone. And so that is one thing. But at the same time, again, respecting your limits and respecting your boundaries. And if you're very traumatized, and if you're in a state where opening yourself up to someone possibly not being good for you feels like more of a risk than just staying how you are, validate that. Find some modalities that you can do on your own, where there's teachings and teachers, and you're being given tools that you don't have to interact with somebody. Because that can be a really good way of learning, number one, how to listen to our own instinct, and how to listen to our own, is this actually working or not? Because there's less pressure to feel like you're doing good and to feel like you're living up to it when there isn't like a person in the room who you're trying to impress or feel a responsibility to, if that's something that you deal with. And it can help you to develop some boundaries. It can help you to develop some tools and some skills. And it can even give you some ways of healing before you step into a therapeutic environment that can make the therapeutic environment more effective. So that's kind of what I want to say. If you've had negative experiences with therapy, is validate that. It's not your fault. You didn't do anything wrong. You never deserve to be treated like that. If you're not being empathed, if you're not being understood, if you're not being given tools that actually work for you, that's on the therapist. That's not on you. And you always should leave that situation and find something better. And like I said, this is an especially good place where we can find tools and books and resources and things like that, where we are not working directly with somebody, and this can be incredibly helpful and a really good bridge over. Okay? So that's the next thing I want to say. So a huge part of what I teach in the mystery school and with my teachings in general on the self-love path are things that I really believe will enhance your therapeutic process if you are going to be in therapy. Because like I said, a therapist can generally only work with what you bring them. They can only be aware of the things that you're aware of. Sometimes they're going to be able to see things you're not seeing. Sometimes they're going to be able to point out things that you're not able to see in yourself, and that's great. But a lot of the time, we're going to go to therapy and they're just hearing our side of the story. They're just hearing our feelings and our perceptions, and that's all they have to go on. So when we have a lot of blocks in our perception, when we don't know that we're numb and not feeling our emotions, when we don't know that certain things are hurting us or harming us in some way, and that's what we're bringing to the therapist is going to just work with that. So this is why I think doing self-love work, which the self-love work that I teach, especially in the mystery school, is again all about learning how to connect to your emotions, learning how to connect to your body, learning how to connect your traumas and your triggers and what happened to you, and seeing patterns and becoming self-aware is incredibly helpful to bring into a therapeutic environment. Because the more you are connected to where you are actually at and what kind of support you actually need right now, the more effective your therapist can be for you, the more effective your coach can be for you, the more effective whoever it is that you're working with can be for you. When you are more aware of where your pain and your trauma and your blocks are, the better they're going to be able to help you, right? It's literally like the difference between going to the hospital, like in one of these House episodes, if you ever watch the TV show House, where the patient that House is dealing with is always like a complete mystery. Like they genuinely have absolutely no idea what's going on with this patient. And for the first 30 minutes of the episode, it's always them going through a whole bunch of things that it isn't, and putting them through a bunch of tests and symptoms getting worse and everything flaring and everything being crazy because no one knows what's going on. And eventually we slowly narrow it down to be able to figure out what's actually going on. And then there's a diagnosis, and then there's a treatment, and everybody's happy, right? That's kind of what it's like when we show up to therapy with no prior work. It's not to say that that's wrong, and it's not to say that we shouldn't do that. Because again, a lot of us, we might get into emergency situations. We might have mental health issues we don't have a diagnosis for. We might have, like I say, emergency situations are really long, drawn out, chronic mental health issues and trauma and things that we've been unaware were even trauma. We didn't know we got hurt in our childhood. We didn't know our parents were toxic. We didn't know all of these things. And we're just coping and coping and coping. And we have all of these symptoms, right? We have our not being able to get out of bed in the morning. We have our deep depressions. We have our debilitating anxiety. We have our whatever it is. And we're showing up to the therapist with the like, I don't know why I have this problem. And again, that's normal. People are going to do that. And if that's where you're at, do that. Go get help. Do not wait until you figure it out. However, it can be very helpful to be able to figure things out for ourselves to a degree before we start to look for someone to support us, because in doing that, we can again be more clear on what our actual issues are and where we're struggling to move forward with our own process. And then that's going to help us better find someone who's suited, whose scope of practice fits what we need. Yeah? And again, the more self-aware we are, the more we're in our emotions, the more we're able to understand where our blocks are on our own, the more we can help the therapist help us in giving us the right tools. The more we can be clear on what we're actually experiencing so that the therapist can be clear on what we need. Because again, right, like that person who I was talking about who is completely divorced from her emotions but has no idea that that's happening. A therapist can't really do anything with that if they're not really well versed in in seeing, oh, you're disconnected from your emotions. This is a thing that you need. This is a modality that I am trained in, and I can give that to you, right? If we just go to a talk therapist and the last thing we need is to talk about our logical minds, we're going to be wasting our money and wasting our time. Okay, so this is, again, a part of why I think that the self-love path is not a replacement for therapy. And it can actually be something that works really, really well with therapy because it gives you self-awareness tools to bring when we need help. And again, that's another thing that I just want to say right here, right now is that we are social beings. And a lot of us, especially if we were not attuned to by our caregivers and we had to be very independent and we had to figure things out by ourselves, and living in this world where our culture in the West is very individualistic. It's very, very separation. It's very we are not connected to one another. It's very we don't have authentic relationships. Sometimes, again, what we need is just another warm body who can be good enough, kind enough, available enough for us. And that's going to be healing. To just be validated and witnessed and supported by someone outside of ourselves, in and of itself, is the support we need. So again, if you are used to doing everything by yourself and you're finding that you're getting blocked in your ability to move forward, sometimes you just need someone to be able to be in the room with you, to validate you, and to support you, and to tell you, these things that happened to you were not okay. You didn't deserve it. To break out of our patterns and our self-hate and our blaming ourselves, we need someone outside of ourselves sometimes to offer that for us. And then that's the other thing too, is sometimes we will have a few therapy sessions and have someone validate us and give us that outside love that we've never gotten, and then we can pick up doing it on our own. And that's the next thing that I want to say too, is that hopefully any therapy that you're doing, especially if it's not for something like chronic or like a mental health issue like bipolar or something like this, because that's a different situation, right? Like when we have a real legitimate like diagnosable mental health condition that is part of our brain chemistry and where medication and therapy are just going to be a part of what we need for the rest of our lives, that's not what I'm talking about. That is a legitimate situation where, again, real working with a real psychiatrist and a real psychologist is probably going to be better than working with a life coach, because people are trained in these very specific diagnoses and what is pertinent for these very specific diagnoses. Yes? But when we're talking about, kind of chronic depression or anxiety or life issues and mental and emotional health issues that are not like a severe diagnosis, hopefully your therapist or whoever you're working with is giving you tools so that you can start to be on your own side and you can start to make changes to your life that make it so that life doesn't hurt so much anymore. They should be giving you tools and resources to help you improve your situation, either externally or even just internally if the external situation can't be changed, that are actually helping you feel better so that you're not just dependent on session after session after session of being witnessed by somebody, but you're not learning how to witness yourself. You're not learning how to hold yourself. You're not learning how to move forward and make changes in your life again so that life actually can start to feel better over time. And if that is happening, like if you're starting to feel dependent on your therapist, I highly encourage you to look for other tools and other supports outside of your therapist that will help you with that, okay? Because we don't want to get into a situation where we just feel like we're dependent on someone else completely and we're not being given tools of support, okay? Now, finally, I want to speak to the idea that, again, if you can't afford therapy and if you are someone who knows that you would really benefit from it, but you can't access it, you can't find someone who resonates with you, it doesn't feel good for you, you've had trauma with your therapist, please know that there are good resources out there that can be at least a bridge over, that can be supportive, that can be tools that you use that are not just therapy. Therapy is not the only thing that exists. And again, for some of us, therapy isn't the answer. For some of us, we need somatic experiencing. Some of us need a friend, not a therapist. Some of us need to read a book and do processing on our own. Some of us need just emotional awareness and to learn how to be with our emotions and how to process them. And that is really what we need. There are so many different places that we can be at on our path of healing and where we can be at in terms of our pain and our trauma and what we've been through. And therapy is only one modality. Okay? So if it is not available for you and if it did not help you, please know it is not the only thing. It is not the only thing. And even talk therapy is not the only therapeutic modality. There are many, many, many different modalities, and we need to acknowledge that we still live in a society where therapy is not available to a lot of the people who actually need it, because there is a massive paywall. And this is part of why, again, I do the work that I do. This is why I've made the Mystery School. This is why I make all of these free videos. This is why I put out as much free content as I possibly can that is therapeutic in nature. Because, yeah, in a perfect world, in an ideal world, we could all have that one therapist that we can afford to go to on a regular basis who knows us really well and who knows how to give us exactly what we need. In an ideal world, everyone who needs that support would have it. But we don't live in that world. And I don't think that it's fair to get to a place where we say The only people who should be giving any kind of emotional, spiritual, trauma help are trained therapists who are charging $200 an hour. Because that would mean so many people who need this work can't find it. And so this is why I'm very interested in training people how to work with resources like this, with free resources, with low cost programs that you put yourself through, with working with people who are not maybe trained therapists, but their services are more affordable or whatever it is for you, that you learn how to do that safely, that you learn how to identify the red flags, that you learn how to work with things for where you are at versus trying to force yourself into a modality. And this is why I talk so much about self-love. Because if we come to any therapeutic environment from the foundation that we are good enough, that we are not broken, and that none of our habits are something that's wrong or bad about us, but it's something we're doing to adapt to the world that we were trained existed. It's how we're dealing with everything we're dealing with. And if we come to our therapeutic, any therapeutic, anything, with the idea that it's just going to be an unfolding of discovering, and that there is no perfect, but we're here to just develop as much awareness as we can, to use the tools when we have them, and to keep working our awareness as much as possible, we are far less likely to be bamboozled or harmed or tricked by people who are selling big promises, and this is going to be the right thing for everybody, and this is going to heal your trauma, and this meditation and this healing thing is going to be the absolute be-all end-all. We are less susceptible to that. And at the same time, we are better able to take the good things from any therapeutic environment and leave the bad things, because we're learning to trust ourselves. So any therapy that you do should start with the base of teaching you how to tune into how you feel about something, how to tune into how something works or doesn't work for you, and how to be honest about that, and how to embrace that, and how to use that to help yourself. Because you should never be forcing yourself to do things in therapy or in any kind of healing modality that feel terrible. You should never be feeling like if you're not getting results, it's because you suck and you just don't want to heal. That's never the case. And if you're ever being told that, please walk away. Okay? If you're ever being told that, okay, this didn't work, you just need to level up, do the next thing, do the next layer, walk away. That's not true. If you're not getting results from the base layer, you're not going to get more results from spending more money. Okay. And now finally, I do want to say, there is something to be aware of with therapy, in that it's still existing within the paradigm of our current structures. Therapy is still existing within the paradigm of our current structures. And a lot of the reason why so many of us need therapy is because of the paradigm of our current structures. This is part of the reason why I didn't go to university and I didn't do that therapy route, because in a lot of ways the therapy I experienced and the psychology I experienced and all that stuff was based around pathologizing a lot of our very normal reactions to a shitty environment that we live in. And a lot of the interventions in therapy are around getting you to be normal, getting you to fit into the cultures that we live in, getting you to be more productive and more consumptive and more normal, right? If you're neurodivergent, a lot of the therapy is about masking and not being who you are so that you can better fit in. If you're anxious and depressed, it's all about like, how can we numb that out so that you can get back to work and you can get back to a normal life and just do what everyone is expecting you to do. And I firmly believe that in a lot of cases, the thing that is causing us our mental distress and our trauma, and the things that caused our caregivers to traumatize us and our, authority figures to traumatize us and all of this stuff, is the culture we live in. It's what is normal is what is harmful. And so again, a lot of the time, therapy is about figuring out what is it inside of you that's making it so that you can't just be okay doing normal, and an attempt to fix that. And for some of us, that's okay. Okay? I'm not judging that. I'm not saying that's wrong or that that's bad. But I'm saying a lot of us are going to experience, we're going to therapists, we're doing the best we can, we're trying our hardest, and we just don't feel better, and we can't do better. Because the problem is we're continuing to try to force ourselves into a life that is never going to work for us. This is why my foundational tool in the mystery school is giving people the awareness of what doesn't work for them about normal culture, and then to give them the emotional, mental, and spiritual tools to be able to figure something else out where that is possible. Because a lot of the time, that is what is going to make you feel better. You can go to therapy until you're blue in the face. But if what is causing you your distress is trying to have this certain career that your caregivers wanted you to have, and your therapist is really trying to help you do that, you're going to feel terrible until you realize you can't do that. A lot of us are deeply emotionally and mentally and spiritually traumatized by the way we are socially conditioned in our world. Right? That we are all so conditioned to be inauthentic, for everything to be about how it looks and not how it feels, to fit in through changing yourself to be what everyone around you wants to be, trends. We live in an invisible classist society. We're constantly being told that we are not good enough, and we're moving more and more and more into the direction of isolation and individualism, and money being the only thing that matters, and the only experiences of life that count are the ones that are productive or consumptive. And I think this is part of the reason why we're all so depressed and anxious and feel terrible in our lives. And again, there's kind of no amount of therapy that's going to change that. We need to start to realize that how culture is and what we are being expected to do is the thing that's hurting. And like I said, there's no amount of therapy that's going to make that better. And so this is part of why I say, therapy is great to the degree that it's helping you actually work through traumas that you need to work through, right? So if you have childhood trauma, caregiver trauma, if you have actual, diagnosable mental health issues, if you just need someone to be there and validate you and see you and empath you because you don't have that in your life, go to therapy. Get therapy. Find a therapist that works for you. If you are in any kind of situation where your life doesn't work for you, where the family that you're in is incredibly toxic and you don't know how to get out, and where trying to fit into culture and do the work that you thought you had to do is hurting you, and all of these kind of like, you don't fit in to culture, and it is trying to fit into culture that is making you miserable, a lot of the time therapy isn't going to be helpful, because again, it's all designed around how do we change you, how do we fix you so that you can fit in, instead of how do we embrace who and what you actually are and do our best to slowly build a life around that. Because that's my perspective, right? I was someone who was never going to fit in. And there was never going to be enough therapy that was going to get rid of my anxiety and my depression and my mental health issues, so long as I was trying to live a normal life. It was never going to work for me. And again, like, I've had situations where the stressor in my life was completely out of my control, and where having someone to problem solve with was really helpful and all of that. But ultimately, the things that have helped me the most have been the things that help me get out of normal and to figure out a different way for myself. And so that's what I offer in my school. It's like, literally, it's a normal isn't working for you, normal didn't work for you. How can you embrace yourself? And how can you undo this conditioning that there's something wrong and bad and broken about you, that you can't do it? And how can you start to validate and honor who and what you actually are, and the traumas you faced, and why it was traumatizing for you? What you needed that you didn't get, what you got that you didn't need, and how you can start to remediate that in your current present environment. How you can process that, yes, and then also make it so that it's different now. Because again, a lot of the time, the things that are traumatizing us is normal, is culture, is what we are expected to do on a daily basis, is the way that we socialize, is the way that we work. So again, there isn't enough therapy that's going to fix that, right? If you keep putting your hand on a burner, you can go to the doctor over and over and over and over again, get it healed up. But then if you put it back on, you're going to get burned again. And so I just feel like, if you have experienced a lot of therapy and no one is saying, okay, if you're continually feeling this way, what is it in your life that's not working for you? It's not you that's broken. It's not you that's just depressed or whatever it is. You have this for a reason. You feel this way for a reason. What's causing it? And it could be your past. It could be physical issues. It could be things that aren't being addressed, or things that just take a long time to address, and that's fine. Sometimes we just need medication. Sometimes we just need support in that way, and that's okay. And there needs to be an acknowledgement that normal, what we have as normal, is very painful for most of us. And that, again, there isn't enough therapy that's going to make it so that that's not true. So are you being supported in figuring out how to make the changes to your life that you can make, so that you're not being harmed by trying to be normal, right? Like that, the person that I spoke about before with the being disconnected from their emotions, they also said that part of what helped them was realizing that everyone in their life was really negative and unsupportive, and they needed to get rid of all their friends and find real friends, right? They didn't actually really need therapy. They needed better relationships, and they were feeling terrible all the time because everyone around them was an asshole. And sometimes that's what we need to realize, is that, like, and so this is why I say, this is why I teach the self-love path the way that I teach it. It's for you to be able to stop blaming and shaming yourself for your pain, so you can figure out where it's actually coming from: physical, mental, emotional, relational. And so that you can say, okay, it's not about me fitting into normal. And if I could just get rid of all my bad habits, everything would be great. It's about realizing I have my scapegoats, I have my coping, I have my numbing, I have my self-sabotage, generally speaking, because I'm trying to get my needs met in the only way I know how, within the culture that I'm in that is not meeting my needs, that is hurting me, that is harming me. within the context of how I was raised, and how I was raised I have to be, and I still feel like I have to be. That does not work for me. And we get through that shame and that guilt and that blame so that we can actually figure out what we need, and where we lost ourselves, and where we got traumatized, and where we got abandoned and abused. So that, again, we can start to build new lives that actually work for us, instead of just trying to fit ourselves into normal. Instead of thinking that, again, right, if I could just get rid of my bad habits, I would feel great. We start to say, no, my bad habits are coping. They're helping me in some way. I need new, different strategies for getting these same needs met. And then I won't need these things anymore. Slowly, over time. Change happens because we're supported in figuring out what we actually need, and we get those needs met. That is why change happens. We never resist change. We're not just not trying to heal. We're doing the best we can with what we have access to, always. So when we're trapped in really negative situations, it's going to be really challenging to change our behavior, because our behavior is a response to that situation. So it has to be about, how do I support myself in figuring out what I need and what is not working for me, than it is about, how do I fix myself so that I can fit in better. So a lot of the time, therapy is just about, how do you fix yourself so that you can fit in better. And for a lot of us, that is never going to be the thing. It's never going to work. So look for a modality. Look for someone who's able to help you figure out what you actually need to live a life that's going to feel good for you. And who doesn't just say, you're just broken, or you're just depressed, or you're just anxious, or you're just maladaptive. You're not maladaptive. Everything you're doing is an adaptation, the best you know how. Even if it has negative consequences, it's how you're getting your needs met right now. So what needs are being met? Where did you get traumatized? Where did you get hurt? What do you need now to slowly get those same needs met and to heal that trauma in a new way? And again, if normal doesn't work for you, find someone to help you figure out a way of life that will work for you. It should not be about trying to get you to be normal. And if it is, they're missing the point. Okay? Okay. So again, that's not everything. It's just some things I wanted to say about therapy. It can be helpful, especially if you have undiagnosed or diagnosed mental health issues. Get therapy. I would never tell anyone not to get therapy. I would never suggest getting a coach if that doesn't feel good for you. But remember, there are lots of different people who have lots of different tools. And it's about learning what you need. So sometimes you need, the mystery school. Sometimes you need a therapist. Sometimes you need medication. There is no wrong way, so long as it's actually benefiting you. And if it's not benefiting you, move on. And if you don't have access, look for things that are being offered that can support you for where you're at. And then we need to understand that, we need to change the system. I'm trying to be a part of that change by offering as much of this as I can for free, in a way that's different than just, how do you fit yourself back into our culture of independence and financial success. Because that's not what everybody needs. And we need to question normal. And if therapy is not helping you question what was normal that hurt you, it's not good therapy. Okay? Okay. So that's that. Thank you for being here. Thank you for listening. Let me know if you have any questions or comments. And I will see you next week. Bye.